In this video, we are presenting the bedside blood group determination method. For this, we most often use the Serofol, also known as the siphon card. Before we begin, I would like to summarize what we need to prepare for the test. We require an unopened Serofol ABO plus D card, which can be stored at room temperature. However, it is recommended to keep it refrigerated for optimal storage conditions. Please remove it from the refrigerator at least 10 minutes before use. We need to check whether it is unopened and whether its expiration date has expired. In addition to the card, we need to prepare a cover paper, which we will place on top of the determination after the card has dried. This way, we can store it in the final report. We need the patient's blood sample. The blood sample can be native, a red-capped serum sample, but the EDTA purple-capped sample is the best solution. In addition to the patient's blood, we also need 0.9% isotonic saline for determination. If we don't have physiological saline, we can use tap water as an alternative. Additionally, we need to prepare a dropper and a mixer. In this video, we are using a plastic test tube for mixing. The mixer must be wiped after each drop to prevent the transfer of red blood cells from one drop to the next. We also need a wipe and a disposal container. First, we open the card. There are 2 cards in a bag. We cut it into 2 pieces. One patient gets 1 card. Then the documentation takes place, which is extremely important. We write the patient's name on the card. After labeling, we take our blood sample and check whether the patient's name matches the name written on the tube. For bedside card determination, we will use whole blood, so we will not centrifuge the sample. After mixing, we use our pipette and, moving from left to right, drop 4 drops of the patient's blood into the center of the circles on the card. The drop should not be too large, as our goal is to observe the agglutination. The 4th drop is self-control. We throw away the pipette and close the sampling tube. In the next step, we drop the same amount of physiological saline solution onto the blood sample. Then, we take the plastic mixer, in our case, the plastic tube, and move it from left to right to mix the samples. The mixer must be wiped after each drop to prevent the transfer of red blood cells from one drop to the next. If we find it too dark, we can add more physiological saline solution to dilute it. The goal is to observe agglutination, the binding of the antigen to the antibody. So anti-A, anti-B, RH, and self-control. Once you have dripped it, tilt and rotate the drops. This determination gives the best reaction at room temperature, 22 to 25 degrees. You need to tilt it for about 4 to 5 minutes. Then, you can read the agglutination and determine the patient's blood type. Here, you can already see that agglutination can be observed with RH. If it is very dark and you cannot see it, you can add a small amount of diluent. In this determination, we only examine the antigens on the surface of the red blood cell along with self-control. It is essential not to go outside the drop, so you need to obtain nice, circular shapes. It seems that our patient's blood type is 0 and RH positive. The self-control is negative. Therefore, there is no agglutination in the anti-A and anti-B areas. And there is the RH factor, but we can wait. The self-control is negative. Our sample is 0 RH positive.